Well, if you haven't had your flu shot yet, shame on you. You're way past due because you should have done that probably a couple of months ago. Well, we have with us today on the show Dr. Williams with Coastal Family Health. How are you?
I am well, thank you very much.
That's good to, in this day and time, that is good to be able to hear.
Yes, it is.
As well. I know everyone right now, and since the first of the year, been worried more about the COVID situation and everything, hoping there'll be a vaccine at some point in time. But and a lot of them probably have forgotten, well, flu season still happens.
Right, and we really need to keep that in mind, because one of the things that we can do to keep ourselves healthy is to get the flu vaccine so that we don't get as sick and miserable with the flu as we could otherwise.
And down here, the way the environment is, the weather changes and everything, makes it more susceptible to catching the flu.
Right. We do have pretty high flu rates. The last few years we've seen an enormous amount of flu, even with the vaccine. Mm-hmm. So we're really hoping to push people getting out there, getting their vaccine, staying safe. It's one thing we can do to prevent it. We can't prevent COVID quite yet. No. But we can prevent this.
Now, this seems like there's always a new strain that comes out every year. So right. I know the CDC and all that, they're just trying to stay on top of everything right. and finding exactly the right type of vaccines that we need.
Right. It's really interesting how they do it, because the flu just circles the world. And so Australia is having their flu season now, and so they just watch it and they pick the strains from there. And the good news from Australia is that they're having a pretty mild flu season.
Well, that's good.
Hopefully that means that we'll have some of the same.
That'll be a good thing, because everything else that we're having to deal with right now.
Exactly.
Tell us a little bit about your work with Coastal Family Health. I've been over there before and talked to you in the clinic and everything, the children's clinic, and it's some wonderful work. Tell us about your work with Coastal Family Health.
Well, I have been with Coastal Family Health for about 11 years. I was recently promoted to the Chief Medical Officer.
Well, congratulations.
So thank you. So I get to have more of a hands-on approach to all aspects of what we do. And the thing about Coastal Family Health is we are what's called an FQHC, which means that we are able to see patients on a sliding scale discount based upon their income. So if you don't have insurance, if you're underinsured, have one of those really high deductible insurance plans, mm-hmm. and you just can't afford to go, then we are a very credible option.
And that's one of the sad things about a lot of the insurances, Dr. Williams, is that you have such a high copay right. that it's like, I can't afford to go.
Right, we see that quite often.
So I'll just buy over-the-counter stuff and hope for the best.
Right, right. And in today's age with COVID and such, we can't afford to do that. We really need to be taking care of ourselves.
Yes, definitely. Now, another one of the things that you do is the telehealth.
Right.
So talk about that, if you would.
This is something that's been out there, but we never really adopted it until COVID, and we needed a way to be able to see our patients. And so all across Mississippi, all across the nation, we've all been learning how to do telehealth, and it really has found its niche. It's not for everything, obviously, mm-hmm. but it is really useful for the chronic disease follow-ups. You have high blood pressure, everything is going well, and you just need to talk to your provider, make sure you're doing all those things that you need to.
And I have done that with my nurse practitioner as well. She done the telehealth thing, and it's kind of funny. I mean, interesting.
It is.
You're sitting there on your phones talking to looking at each other like that. And
it really is. I can say as a physician, I've gotten to see inside some really interesting family homes. And I've been at the hair salon and all sorts of places. So it really does add a new dimension to that.
And probably met some new family pets,
because
they're like, yes. Oh, look at Bobo.
Exactly. Especially with kids, they love to show all that off.
Definitely. And it probably makes it more at ease for the children.
Exactly.
And so, because again, your clinic is wonderful. I mean, it's very child friendly, and that's one of the great things about it there at Coastal Family Health. It's very child friendly, and then you have, but still going to the doctor can be a little bit intimidating, not only to the children, but to some adults. Mm-hmm. And then being there on the telehealth thing, it's like, right. Okay, I'm in the comfort of my home, or in my hair salon, yeah. and talking to my doctor, and letting her know exactly what the issue.
Some of my adolescents, it really seems to be a good medium for them. They feel comfortable in that environment.
Well, they're used to that.
They are, and so talking about hard things becomes a little bit easier in that environment. So I've really enjoyed it for that as well.
So, and it's something that's really easy because, like with mine, set up an appointment, they call you on the phone, and then
Get the link sent to you.
Yes.
And then as soon as you sign on, it sends me a message that you're there, and so I can click on, and that's it.
Well, mine, we just did the FaceTime on the telephone. She just called me. We did it that way. But yes, you can do the other one as well, where you click on with your computer if you got a or iPad or something like that. That works well. So tell us about some of the other things going on there at Coastal Family Health.
Well, along with the telehealth, which we're trying to get going, we're also trying to find new and innovative ways to get the other stuff done, get the blood pressure checks done, or the A1Cs if you're a diabetic. So we've invested and are working out ways to do drive up. So you can come in and just drive up, and the lab will come out and get your lab test for you, and that way we're still getting the valuable information that we need in order to make good decisions, but keeping you safe.
Kind of like the drive-through COVID things that they do.
Exactly.
And that's what's been going on where you...
And drive up flu vaccines, and we're just changing everything these days.
Come through, get a sticker, and...
That's right.
So that works real well. So again, we want to remind people, we got about a minute and a half left, the importance of getting your flu shots right now.
Very important. One thing you can do to protect yourself. Definitely,
definitely. Eating healthy is one of the big things too, and I know that's one of the things that you talk to your patients about too. And Mississippi, unfortunately, is not one of the healthiest states in the country, especially when it comes to dietary situations. Right. So that's one of the big things too, is just trying to eat healthier.
Eat healthy, getting some exercise, going out for a walk, and then learning to manage stress. We're all under a lot of stress right now, so just kind of recognizing it and learning how to deal with it.
We have a beautiful beach.
We do.
Go down there and just, sit on the seawall and just watch the waves crash in, or, maybe cold, but just stick your toes in the water and everything. Just kind of, walk along the beach there. I mean, that's a great stress relief to do. So, as you said, anything that you can think of, again, when you're going out places, you want to practice social distancing.
Wear your mask.
Wear your mask.
Wash your hands.
All the time. All the time. I keep the cleaner in my hands all the time. Now, if they want to set up an appointment, I guess they can just call and find out what's.
And they can find the number on our website. We also have a Facebook that they can find, and that'll get them to our call center, and they'll schedule them appropriately.
All right. Dr. Williams, it's so good to see you again. Thank you so much for coming in the studio and sharing information on that. Again, I would remind you that flu season's here. It's been here. So you need to get your flu shot if you haven't done so, or if you need a telehealth check, you can give them a call at Coastal Family Health here on the Gulf Coast.